making the call is going to be the hardest part of it. So the fact that you did that, I'm not going to tell you it's not going to ever be hard again. Therapy is hard work, but making the call is the scariest because you are leaping into the unknown, and I'm just so proud that you did it.
Hey everyone, welcome to Clinical and Curious. I'm Maddie, a licensed clinical therapist.
And I'm, just trying to keep up.
That's one way to put it.
I ask the questions everybody's too afraid to ask.
And I translate the jargon, bust the myths, and try to keep Adam from diagnosing himself with every condition we discuss. This is the podcast where the expert and the everyday person finally get in the same room to have open, honest, and thankfully pretty funny conversations about mental health.
Yeah, we're ditching the confusing terms and making this stuff approachable for everyone. Whether you're here to learn something new, share a few laughs, or finally understand what's going on in your heads,
you're in the right place.
So settle in, grab a coffee, and let's get curious.
And clinical.
You made the call, now what? The hardest part is making the appointment. You're scrolling Google late at night and you find a clinic. Let's pretend it's our clinic. What happens when you make the call? We're going to ask Adam, who handles the administrative side of this business, and figure out what happens when you pick up the call. So if I call Encompass, who am I getting? What happens?
Yeah, so I mean, again, we're premising this on us, right? Everybody's a little different. We like to go a little bit above and beyond, we like to think. So you will be directed to our intake coordinator. So her job is just handle all these questions, all the questions that can be from the littlest things to the biggest things. The idea is that there's no stone left unturned. But you will talk to her. We always want to start off by first learning what brings you to therapy, right? We want to put the person before all of the details, right? Like, so you kind of figure out like what you're here for. You're searching for your child, yourself, couples, those kinds of things. Now, from a compliance perspective, we always have the bullet points, right? But by doing that, our intake coordinator can match up with our team of therapists. And at the time of this, we have 18 therapists, so there's a lot of choices between which therapist is right for you. But it always starts off first and foremost of why are you picking up the phone? Because that's the first level that we need to figure out. So after we figure those out, right, we kind of go down the line of a lot of, we like to just call them, demographic type questions, right? We obviously are going to get to know you, your name, maybe your child's name, ages, date of birth, all those kinds of things. We like to think of it, if you think of it like layers of a colander, there are obviously financial things we need to figure out. So we're going to ask you your insurance company. And why that matters is we want to make sure that we are an in-network provider, or if we're not an in-network provider, we can provide you those details of the cost or options that may be not at our clinic for those who maybe take your insurance. So we're going to go through all of that with you and make sure that we're matching it up. And then the biggest thing with us and how we differentiate too is we're going to want to find the times that work for you. Therapy is a reoccurring thing. It's not like a dentist where you're coming every 6 months, hopefully. You're usually starting off weekly or bi-weekly at a therapy appointment. So we're trying to find a time that works for your schedule. We like to call it block scheduling at Encompass. But what that basically means is that you will be fit into a time slot that fits for you. Maybe that's Mondays at 2:00. And we're going to book that out for a long time. It doesn't mean you're necessarily going to be with us that whole journey, but we're protecting that time for you so then you can build that into your calendar, your family's calendar, to set you up for the most success.
Yeah, absolutely. And then I've found my time. I've made the call.
Yeah.
I'm comfortable with the therapist choice. All of our therapists have videos on the website that you can watch to feel comfortable with it, or you can take our Therapy Finder quiz before you call if you're really nervous about it. But you've got your appointment. Then what happens? Like, I'm booked. What do I do next?
Yeah, so I mean, there becomes the laundry list of paperwork that we have to go through. We try to make it as simple as we can by making it all online. We always tell people book about 15 minutes of your time, late at night, maybe with a coffee or whatever. Probably not coffee late at night. Don't do it. But find 15 minutes to fill out that paperwork. And that's actually very important because that helps your clinician learn a little bit more about you. And obviously there are compliance aspects in there, whether that's privacy policies, all those kinds of things. But leading out to your appointment, usually we schedule a week to 2 weeks before your appointment. So in that time period, there's not a lot of work to do. I mean, there's not, minus the paperwork and things of that nature and some assessments that we ask you to do to prepare for that session. But that kind of leads into that first appointment date. And from there, assuming all the paperwork is done, we've handled all the billing questions as well. So you know exactly what you're paying out of pocket and what your insurance will be paying out of pocket. That's completely transparent. So you lead into our first session, you come to our office, the beautiful office, and you are greeted by our administrative staff welcoming you, kind of just going through the lay of the land, how your day would work when you come here to see us, whether that's weekly, bi-weekly, monthly, whatever. We kind of showcase you the office, and then you kind of wait for your therapist for that first appointment.
Yeah. So picking up from there, if you're sitting in the waiting room, your therapist is going to come out and greet you. Generally, this was actually a test question on my licensing exam is like, you have a new client in the waiting room. How should
How'd
you
you
greet
do
them?
it? Yeah.
Yes. And I knew that, and so the correct answer is you sort of say like, my name is Madison. Is anyone looking for me?
Yeah.
Generally our administrative team will kind of point us in the direction. They'll say like, oh, there's a gal in a blue dress in the corner. And so we can just go over and I'll say, like, I'm Madison. You have an appointment with me, and then they'll come back. And so you're going to come back to our office. It's going to feel odd. We're not going to talk to you a ton in the hall because we want to respect your privacy.
Yeah.
And so, we'll get settled. We probably both have a coffee or a tea at that point because we always do.
Show
And
you where the bathrooms are.
Yes. Yeah. Very important piece. And then we kind of get into that intake process.
Which, and then that kind of flips our roles here, right? So let's talk a little bit about that first session, because I think that there's this like I'm going to initially start therapy the first session, and predominantly that does not happen, even though there is some pre-work that's been done with you filling out your forms. But let's talk a little bit about that. So I think it kind of first starts off with you kind of go through some of the legal perspectives of what therapy is and what therapy isn't. So maybe we can highlight a little bit of that.
Yep. So just like making sure that you don't have any questions on the paperwork, because you can't actually give informed consent if you don't understand what you were signing.
Yeah.
So making sure that if you have any questions, those are addressed. I myself use like an AI note taker. So that's a separate consent that I'm like reviewing and going over with them, making sure that they understand that, if they're comfortable with me using it, getting their signature on that form. And then if they don't have any questions, kind of opening the door. Generally, I'll say something along the lines of like, so I reviewed your paperwork. I'm really curious to know, with all of that, what you filled out, why was right now the time that you called?
Yeah, I think it's important. Let's highlight quickly too what it looks like if you're bringing a little with you, right? A child, because we work with a lot of children here as well. I know Madison doesn't work as much with littles, right? But the process is similar. We do most therapists invite the child to come to the first session to mostly just see a face. All of our business cards have the pictures of our therapist on it too, so that helps kids sometimes identify who their therapist is. And obviously kids even less so to even know what therapy is. And we kind of talk about like play and how that's their language and those kinds of things. But our office is uniquely designed with all of our play therapists where there's 2 rooms. So the child can be in a back room, which is our playroom. And that allows the clinician to work with the parent to talk about stuff that helps them clear up kind of why the child is seeking therapy. And honestly, some of the boring stuff that the kid doesn't care about, the privacy policy. It works out really well to have a child there that first session versus waiting the first session. It doesn't mean you can't do that, but it does help. Not I would say even waste the second session, but it helps you get running faster into the second session with the therapeutic process. So anything I missed on that? I mean, I know you're not a child therapist, but
with that, sometimes, especially if there are things that are not appropriate for child ears, might be a time that you maybe want to bring another adult with, so they could go into the waiting room, because while there are 2 rooms, they're not entirely soundproof between them. And maybe your child's not comfortable with the door being closed in a new space. And so if you're able, maybe bringing a second adult, or possibly that, we can turn up the sound machines and close that door, just because we want to make sure that if there are things like trauma histories, custody agreements, right? Like things that are not developmentally appropriate for little ears do not reach little ears.
Yeah, I love it because it's very much directed by the expert as in the parent, right? Of saying like they know their kid better than we do. And so like sometimes kids' transitions are hard and they need that session where a parent is with them. And sometimes the second session, even the parent might stick around a little bit more during the session. But we always like to say our intake process is built around you, right? And what you're comfortable with. Obviously, there are boxes we must check and go through from a compliance perspective, but by and large, I think the hard answer to say is like the therapy process, even that first session, is very driven by the client.
Yeah.
And the therapist is there to support, of course,
Yeah.
and
Yeah.
guide that. So outside of that, now we kind of talked a little bit, but like what else is happening during that first session?
Yeah. So we're collecting history. So we're conducting what's called a biopsychosocial assessment. And if
Say it 5 times fast. You can't.
biopsychosocial. And then if you're me, you're doing a biopsychosocial sexual assessment. So we're adding in the sexual component as a sex therapist. So this is getting that full picture. Biology, psychology, environment. I want to know what your mom's pregnancy was like with you. Was there anything, right? Like we can go from an epigenetic level, right? There are things that influence us all through our lifespan from conception, cradle to grave, right? And so I want to know all of those things because if you have a thyroid problem, that's biological, but it can affect your mood. And we need to know about that and evaluate for it and maybe even get you assessed if it's been 6 years since you've seen a doctor.
Yeah, I think it's important too. Like, we'll do this on the admin side too, but like when you get all the paperwork initially, it can seem overwhelming, but it goes back to the core of why you reached out, I believe, right? Is that we want to know it down to that level because the goal isn't for you to be in therapy for the rest of your life, right? The goal is that we have our journey together and then you go on and continue your journey. And by getting questions answered that may seem not even relevant to you, may be very relevant to your therapist to help your journey be clearer.
Yeah.
And so I always tell people that like answering those questions, while it may seem like overwhelming, it definitely helps the process because again, we do want our journey together to end in a positive manner, and this things like this definitely build that foundation.
Well, and that's the whole thing is that like I'm also not going to push you. If there are things that if when we get to the section around like trauma, violence histories, criminal records, all of those questions, if you're not comfortable answering them, you're totally allowed to pass, to say, I'm not ready for that, or like again, be centered. Because we're trying to build this picture, but it's at your pace. So if you aren't ready to go there to share those things, that's okay. Because one of the things in this intake process that I'm telling my clients is the biggest indicator of this being successful is whether or not we build a good relationship.
Yeah. Well, that talks about like therapist fit, right?
Yeah.
Like, so to go back to when we first started this podcast episode was talking about like trying to find the right therapist fit for you. And I didn't say this, but like using our Therapy Finder tool, sometimes you come in with a therapist that you want. Maybe you had a referral from a friend or another professional in the community, and that's great. And we will always try to match with that. Our goal is never to sway you off of Madison, for example, or anybody else. It's to find that right fit though. But the reality is, sometimes we get it wrong, or sometimes the fit isn't right because of clinical acumen potentially, or the diagnostic personalities.
Yeah.
There's a myriad of things, of course, but and it's okay for you to say that, and it's okay for you to advocate for yourself. It doesn't mean that you are insulting the therapist.
Yeah, no, I'm never going to take it personally. I tell everybody, and I think that that's really important as therapists, that we remind our clients of that like, this is not about me, and so I'm not everybody's cup of tea, and that's totally fine. You might find the way that I do things to be not to your liking.
Yep.
That's fine. Please tell me. I generally tell people like, give it 3 tries. If it still feels weird, if you're uncomfortable, if you don't like the fact that I'm going to kick my shoes off and put them up on my chair, whatever, I'll find you somebody else, because what matters is that you feel comfortable enough to heal.
Right. Yeah, absolutely. I think that that's super important is you are the advocate, and we want to make sure that you feel comfortable and you feel like that there's progress being made. So let's talk a little bit just about, so to finish up on that first intake session, right? Sessions, we kind of breeze over this. Typically it's about an hour long, give or take. We always tell people to block about an hour, maybe 15 minutes on either side of that, just to get everything done and get out the door. Anything else that's kind of happening during that first session only that you're like, maybe we should tell people about?
Yeah. If somebody's coming in, like in a crisis, right, and they're really dysregulated, I am going to make sure that I carve out the last 10-ish minutes to like make sure I can try and get them regulated, give them some coping skills to just like build that. So that way I'm not just like ripping off a Band-Aid that's still actively bleeding and then being like, all right, see you in a week, right? That's not safe. So while that's not the premise of the first session, if somebody needs that, it's absolutely necessary and important that we are treating the human that's in the room
Yep.
and not the diagnosis.
Absolutely. Well, and I think too, it's important to realize too, like we're an insurance-based practice, so there are again things that come forward that we have to check box for insurance regulation stuff, and again, because most people will use their insurance policies with our practice. And so what I'm getting at with that is that this doesn't necessarily all happen in that first session, but there'll be a diagnosis made, of course, and then treatment goals and those are talked about amongst therapist and client as well. There's not just, that's not made under the, the door closes.
Right. And so generally I'm asking, what do you want to get out of therapy? How does life look different for you? What changes, what skills do you want to have? What do you want to get better?
Yeah.
Right. And then they're giving me that in like normal human words. And then I'm turning it into insurance jargon, saying, they're going to learn X number of things about X in Y time.
Right. Well, I think that's the beauty of therapy, though. That's what's going underneath the small talk, right? Like when you and I are talking in a therapy session, right? Like it's not just the words that are being said. It's like that's what the therapist is. Education and reps have been done is I always like to say, like, read beneath the line, right? Like they're reading it. Yeah.
We're looking for patterns over time in your relationships, in the things that cause you anxiety, in the times you felt depressed, right? Like we're noticing patterns and we're working to interrupt those.
Right.
And so sometimes it might seem strange that we're asking about this sort of thing, but we want to know about, you might say, oh, I'm not religious right now, but I'm like, okay, but tell me about growing up, right? Oh, okay. Well, you were raised in, a very religious, very strictly, whatever you might have. And that's still going to show up and impact you because your morality is already sort of built as from that and how you feel about it. So it might not feel relevant, but we're looking for a lot of patterns over time. And so bear with us a little bit as we ask, did you potty train? Okay. Or those sorts of things.
Sure. Let's talk about red flags. I always, because again, not all practices are the same. And we're talking how Encompass does things. And I want to give people red flags of things that maybe if they don't choose to come to Encompass and somewhere else, and what they should be alerted to, of like saying like, this isn't normal practice stuff.
Yeah.
I'll start a little bit on the admin side. And I want you to highlight maybe some clinical things. So first and foremost, one thing that you absolutely should never go in a session with is you should have complete transparency on cost. That's not, it's actually legally required by the government, called the good faith estimate of understanding what your costs are medically. And any therapist practice should be able to tell you what your patient responsibility is versus insurance. And you have every right to ask for that. We do this in a formal process on our billing authorization forms. Everybody does it maybe a little bit different, but you absolutely should not go into a session without understanding what your costs are. And specifically, I would make sure to note on that, not what their billable rates are, but what your patient responsibility is. There's a difference there. And so you should just know what you are going to have to pay them every time you see them. So that's one big thing that definitely is not done well in the industry.
Yeah. Okay. From like the clinical side, the first thing that comes to mind, and this is both a like personal and a professional preference, is like they shouldn't touch you at all. I can count on one hand the number of times that a client has hugged me, and in all 6 of them, maybe if they exist, I don't know how many, were heavily documented because like touch is not normal in a therapeutic relationship. Like it is. It needs to be warranted. There needs to be like there needs to be like a clinical reason why you might be touching them, or like even a hug, right? Like there is different. So they shouldn't touch you. This is talk therapy, right? We are talking. We are not doing other things. Now that's not like when I say talk therapy, you might play Uno if you're with kids, right? But like they shouldn't be touching you. They shouldn't be touching your children. That's a huge red flag. That's a big safety concern. If you feel like trust your gut, like if they give you like an icky feeling that you like just don't feel safe in their space, or you feel like you can trust that too, that your intuition is there. It's unfortunate that this happens in our work because there are ethics boards and licenses and those sorts of things, but like no system is 100% foolproof. So yeah, other things like red flags would be like asking you to like pay in advance. I think that get more in those like business shady sides. Yeah,
that leads me to my other one that's kind of financially related is ethical billing is a thing that I unfortunately don't. You see too many people doing it wrong. Meaning, should be different billable rates. Well, there are different billable rates. Excuse me, for different times of session. Right. If you see your clinician for half the time you did a week ago, and they're charging you the same, that's absolutely a red flag. Those rates should be less. And again, you should ask your clinician or their practice for a billable breakdown. Again, it's something that we pride ourselves on in Compass is you'll know exactly all the prices for the different times. Most of our stuff in our world is time-based. So you would know if you see your clinician for X amount of time, how much, again, your financial responsibility is and what insurance is being billed for that. A lot, like I said, it's mostly, sometimes it's ignorance. I think it is more than deception. But again, making sure that you understand your financial costs is one. Gosh, what else?
I mean, to feel awkward is normal here.
Yeah.
Like, to feel unsafe is not.
Yeah.
And so I think that that's the biggest piece that you have to kind of check in with yourself and just kind of decide. I'm trying to like replay, all the practices and the times of things of what have I seen in my life and in my work of like what is there. But really it comes down to like to fit truly. Like they could maybe be a great therapist that knows things, but if they aren't jiving with you, that's okay.
Yeah, no, I mean, from like I said, those are the kind of red flags from those first sessions. I would say, definitely things to look out for. But I mean, I would say like if it doesn't feel right, it's probably not right.
Yeah,
right? Like
yeah.
that's just a general
Yes,
thing. And in our world too, like marketing tactics, things like that are real kind of shied upon. Like meaning like they can't ask you for reviews, things like that.
Yeah.
Putting your name in a public forum that says like I went to this clinic.
Yeah.
Even after that first session, like that's illegal and you should not be asked to do those things.
I had a therapist send me a Christmas card
Yeah.
to my home with her children on it.
Sure.
And I had moved. I don't know how she got
Yeah.
the new address.
Yeah.
So
See,
like concerning.
That's a concerning thing. Yeah. I don't, as much as you don't want to say this, is the relationship is transactional, right? It's a paid for service. It shouldn't be, you kind of go at the speed of the client,
Yes,
right?
yes.
Like not the therapist.
And this idea that you're paying for it does not mean that we don't care about you. I get that sometimes from like my sassy teenagers. They'll be like, well, you have to care about me. Like my parents are paying for this. And I was like, listen, if your parents wanted to buy you a friend, that would be a completely different tax bracket. I care about you because I've gotten to know you and I care about you as a human, right? Like there are still times, and it's hard because, like kids will give me their graduation invites and I can't go.
Yeah.
Right. And I'll feel bad and we'll have to have that conversation, but I'm thinking about them when they go off to college and I don't see them anymore because they went out of state when I'm not licensed. Like you don't just disappear from my brain. I hope you're doing amazing. I hope you stop needing me. And it doesn't mean that I'm not sad. So any of my former clients who ever listen to it, you can totally send me an email and tell me how life is.
Yeah.
That's fine.
Absolutely. No, I mean, and that's exactly, we're human beings. Like, and it's just, we always say like we're obnoxiously ethical. So we will follow the rule, probably even beyond what it even states, just to make sure that you feel that your privacy is protected and also that you are knowledgeable about what the therapy process is all about.
Mm-hmm.
So, in summary, from us, again, we're speaking from us, is that we want to make sure that you have all those resources, right? So again, going to our website, finding all those things so you can know not just the clinician you want, but the type of therapy that you think might be best. And again, there are those kind of great conversations you can have with your therapist about whether that's, play therapy, whether there's trauma work with EMDR, like those are questions you should ask of your therapist or even of our admin team, and they can help guide you on that. Using our therapy tool on our website to find the best match is a great way to start too. We can kind of put some check boxes or levels of the colander to help, again, spit out therapists that we believe are best. But we always just say, as nerve-wracking as pick up the phone, you'll be greeted with a great individual who wants to help you. It's there to help you, and they will literally be able to listen to you and figure out exactly what brings you to make that call. Recommend all those things. Anything else in passing from a therapy side, Maddie, that you want to make sure people know about?
Making the call is going to be the hardest part of it. So the fact that you did that, I'm not going to tell you it's not going to ever be hard again. Therapy is hard work, but making the call is the scariest because you are leaping into the unknown, and I'm just so proud that you did it.
Absolutely. Yeah. Asking for help is a tremendous thing that you can say you did for yourself or for somebody in your family. So good on you for making that call, and just know that you're in a safe place. So again, any questions, visit our website, siouxfallscounseling.com. Please make sure to reach out, either phone, email. You can even text us. We will make sure to get back to you. So appreciate you listening. We'll see you next time.
Thanks for listening to another episode of Clinical and Curious.
If you're looking for professional support for yourself or your family, the team at Encompass Mental Health is here for you.
You can find us at siouxfallscounseling.com.
Take care, everyone.
And stay curious.
A quick reminder, the content shared on Clinical and Curious, including recommendations or opinions, is for informational and entertainment purposes only. While I am a licensed therapist, listening to this podcast does not create a therapist-patient relationship, and the information here does not constitute medical or psychological advice. Always seek the advice of your own physician or mental health professional regarding any specific questions or conditions. If you are in crisis or experiencing an emergency, please call 911 or the Suicide Crisis Line at 988 immediately.